Artificial intelligence may offer promising tools for mental health care. We're talking about virtual therapists, perhaps, or assisting with clinical notes. But one expert says its use must balance benefits with risks. She is developing guidelines for regulating AI in mental health treatment settings. We're joined now by Kim Corace, Vice President of Innovation and a Senior Scientist at the Canadian Centre on Substance Use and Addiction. Thank you very much for joining us, Kim.
Thank you for having me.
I know it's a fast-moving field, but give us one or two settings or one or two uses that you do see for AI in psychiatric or mental health care.
Absolutely. So AI is popping up all over the place and being investigated in many different delivery mechanisms for mental health and substance use healthcare, from how we access care to virtual chatbots to triaging and matching people to the appropriate level of care, to predicting risk, symptom monitoring, and also helping with some of the administrative burdens related to healthcare, like our clinical notes.
That's interesting. Predicting risk, just looking at behavior. I don't know. I presume people are exploring body language and voice to see how much help somebody might need.
Well, there's all sorts of ways, from symptom monitoring to self-report to physiological monitoring. So how do we use people's data, other people's data, to basically be able to predict risk profiles? So when maybe someone is at higher risk for having a mental health related crisis, when somebody's maybe at higher risk for having an overdose, and how can we use AI to help clinicians make decisions and determine when and what that risk is, and be able to respond faster and more appropriately, and ultimately reduce harms to people.
I'm just wondering, though, obviously people who come seeking help of this kind, they're under extreme stress. Is it a good idea to have them contacting AI? I think if I was in that situation, I would feel I was being fobbed off if I had to get past an AI gatekeeper.
Oh, and we're talking about what are the possibilities of where AI is popping up and where it's being investigated, not necessarily what we know is safe, effective, and delivered in the way that patients or clients are looking for how they're getting their care. If you talk to people with lived and living experience who have mental health and substance use health problems, they'll tell you they don't want to go through extra levels and extra steps to be able to be connected with somebody. But there may also be data that can be used in the background that when they're being, monitored remotely or whatever, that they can alert the clinician to when maybe somebody's in need of extra assistance or extra help. But we're not there yet, as we said at the beginning, with balancing these great potential benefits to also the risks of safety, effectiveness, and let alone whose data and where does that data come from to make those predictions.
Now, we have heard stories of people using AI chatbots as companions to help with their mental health. And apparently there are hazards here. The chatbots, well, they're not qualified professionals, and they can reinforce delusions among people. Do you see dangers in this area? Sorry.
No, I'm sorry I interrupted you. Absolutely. So a few things with that. One, many of these AI-related tools have not been designed for people with mental health or substance use health problems. So they're being used in a way they were never intended to. And with that, you're talking about the principles of reinforced delusions or hallucinations or psychotic symptoms among people who already have existing psychotic-related mental health problems. And also, what about the other AI errors, misinformation? AI, some of these chatbots and these tools, they're really good at being plausible and convincing. And it could be convincing people in a whole direction that actually not only isn't helpful, but potentially could be harmful. We've seen instances of AI tools for people who are looking for help with eating disorders, giving them weight loss advice.
It's interesting that, chatbots typically won't, well, with the exception of Grok perhaps, but Elon Musk typically won't honor a request for pornographic stuff or offensive stuff. Is it time to consider preventing chatbots from giving mental health advice?
I think it's time for, if we're going to implement or use tools to provide any type of mental health or substance use health advice or intervention of any kind, that they need to be properly investigated, regulated, and have guardrails in place. I mean, people will tell you there's not enough access to mental health and substance use health services, that people are waiting a really long time for care. So we have to balance looking for innovations in how we deliver that care with making sure what we're delivering is actually quality, effective, safe, free of bias, and actually doesn't create further harms than when people are coming in with.
There are advantages, I gather, in reducing bureaucratic drudgery for clinicians and nurses, et cetera. And I think this is true of the medical profession altogether. Could you talk a bit about that?
Yeah, and I'm a clinician myself as well. So, working with, there's people and clinicians, and if you look at the research out there, they'll talk about the huge administrative burden of delivering healthcare at a time where there's increasing complexity and a feeling of not enough time to actually do our work. So there's possibilities from AI scribes to, which would be like supporting our note taking, to AI-assisted decision-making tools, so that we'd have some of them, always ensure the latest up-to-date information is at the fingertips and helping us. But these are all tools to make the job easier as well, not necessarily delivering the care itself. So really supporting clinicians to deliver that high quality care, reducing the time burden to us, and reducing the administrative load, your word, drudgery, to those of us providing care, rather than, replacing the field itself.
Kim, thank you very much indeed for joining us. Kim Corace.
Thank you very much.
Is Vice President of Innovation and Senior Scientist at the Canadian Centre on Substance Use and Addiction.